was it that you were able to get into the unit to see her?
12:30 in the afternoon,
What day?
February 4th.
So it would be January 24th, 7, so this is almost
11 days.
later, right?
Yes,
You're also aware that I needed a court order to get you into the hospital.
that's correct.
And were you able to ultimately get in the hospital, go to the surgical unit, and meet with Lindsay?
Yes,
Jurors have had a chance to look at photographs of her laying in the bed with tubes and wires and all of that. Is that what she looked like when you first saw her?
yes. However, she was also, with her right arm, as I recall, shackled to the bed with handcuffs.
So they're not little soft little things that tie her hands to the side of the bed, but they're handcuffs?
They weren't soft. They were regular, but appeared to be metal handcuffs that police officers and perhaps officers in this court use for detaining people and arresting people.
So,
they were not soft.
While she's laying in the bed, did she have the tubes and the wires for treatment in the emergency, the intensive care unit, I should say?
Yes.
Was she intubated at that point, if you recall?
She was not.
So she was able to speak?
Yes.
Was she able to move obviously she's chained to the bed, so she couldn't get up?
She could not get up. She couldn't move below her sternum, the chest bone.
At that point, had you and I met and talked about this case at all?
No.
What was the reason I asked you to go to the hospital?
You were worried about her mental health, given the significant event that had just taken place a few days earlier. You were concerned that she had absolutely no ability to have visitors. Visitors were not permitted to meet with her, from family members to friends to a priest. No one was able to see her.
So as a result of that conversation we had, you went to the hospital, went into her room, and you were able to speak to her. Is that correct?
Yes.
Can you tell the jurors, if you recall, what type of law enforcement presence? Uniform, cops, guns, stuff like that. What did you notice?
I noticed literally outside of her hospital room were 2 state troopers in their blue uniforms, sitting each in a chair on either side of the doorway to Ms. Clancy's room, with a nurse sitting in the corner of her room.
When you went in to see her on that date, was it your understanding she had recently been extubated? In other words, they removed the tube from her mouth?
Yes.
And do you recall the conversation that you had with Lindsay at that time?
Yes, I did.
Tell the jurors what your memory is.
The conversation I had with Ms. Clancy at that time was one where I asked if she knew where she was. So I did what's called a mental status exam, a brief mental status exam. It's orientation to time, place, location. She didn't know where she was, wasn't quite sure what time it was. She knew who she was. And she told me that she remembers what happened, but it was very fuzzy and foggy. At the time, she had been on medication for the significant pain post-surgery while in that hospital room.
And during the course of that interview with her, did she express any concern to you about her husband, Patrick?
Yes, she did.
Tell the jurors what she indicated to you.
She said, since 11 days prior to my meeting with her, which would have been January 24th, 2023, she had no contact with Patrick. She wanted to know how he was doing. She wanted to know if she could call him and find out where things are with her and with him and how he was faring, and to just speak with him.
She expressed concern about her family.
Yes, she did.
Did she express concern about what had happened?
Yes.
Did she ask you, or did you offer to her the ability to speak to her husband, Patrick?
She asked me if she could use my cell phone to call her husband.
Did she do that?
Yes, she did.
Did you hear the conversation?
Yes, I told her we'd call It would have to be on speakerphone.
And tell us about that conversation.
So that first phone call, I believe on the 24th, he did not pick up. She left a message. I did not leave a message. We then called back 2 days later on the 6th.
And after the 2 days had transpired and the call was made on the 6th, did she have a chance to talk to Patrick?
Yes.
Were you there?
Yes.
Was she still chained to the bed?
Yes.
Were the cops still outside the room?
Yes, not in blues. They were in civilian clothing, jeans, flannel shirts.
And tell us what she said to Patrick in your presence on the speakerphone at that point.
She had told Patrick that she loved him very much. She was unable to express a lot of emotion, but she expressed love for him. And she had said that she heard a male voice ordering her, telling her that she didn't have any choice, but she had to kill her children and then kill herself.
Now, doctor, have in mind your background, your career, Did you tell Lindsay Clancy to lie or make that up and pretend that she was hearing voices?
No.
Did you have any conversation or any suggestions to her at all that she should say she heard voices or anything like that?
Absolutely not.
Why did you let her call her husband on your cell phone?
I let her call her husband out of human compassion.
As time went by, did I then, oh, by the way, you've testified for me on other matters, have you not?
Yes.
We go back about 20 years?
Yes.
And we socialized together?
Yes.
So we're friends?
Yes.
And as you worked on the case, can you tell the jurors what information you had access to that would allow you to continue with your investigation as a psychologist?
I had access to her clinical records. Many of that were discussed here. Emergency records, grand jury minutes. With the longitudinal nature of my evaluation, I had records from Brigham and Women's, South Shore, Spalding Hospital, and most recently, Tewksbury Hospital, which go back to, I believe, March 27th or so, 2023 till today.
How many times have you seen Lindsay since that day in January of 24?
So I've met with 2023. I've met with Ms. Clancy over 45 times since then, and that was at the writing and the issuance of my report to Attorney Reddington. That was in the middle of June, and I've seen Ms. Clancy since then 20 times probably, or 15, inclusive of being in this courtroom and sometimes meeting with her in the holding unit.
And you've had occasion to visit with her in Tewksbury Hospital many of those times, right?
Yes.
And you've had occasion to visit with her in the lockup to this courthouse, correct?
Yes.
And she's been treated very well by everybody, the court officers, everybody. Is that correct?
Objection. Relevance.
Yeah, that's sustained.
Well, you've had a chance to see her in the lockup, right?
Yes.
Why would
No, overruled.
Why would you see her in the lockup?
I would see Lindsay Clancy in lockup because the nature of presentation in this court has been gut-wrenching for anyone who would be exposed to such horrific
Objection and move to strike. It's not responsive to the question.
All right. Can I see counsel here?
I'll withdraw it.
All right, so that answer, ladies and gentlemen, that answer is stricken.
In
Okay.
Tewksbury Hospital, have you had to see her to evaluate her in addition to your testimony for a jury?
Yes.
Why?
because the nature of mental health is something that's not a static or what we consider historical piece of information. Static information means a date of birth. That's never going to change. Dynamic issues are things that are subject to change, like the weather, like your health, like your mood. So to do an evaluation for a case that Ms. Clancy's involved in, which is a triple homicide case, requires an examiner to ensure that she's competent to stand trial and that her mental health is stable enough to be able to go forward with court proceedings.
Is there an additional component, and has there been an additional component of her suicidal ideation since she's been in custody at Brigham and Women's, and then, of course, transferred years ago to Tewksbury?
Objection. Approach, please.
Can I see counsel?
So, Doctor, while you're evaluating her, whether it be in Tewksbury or you're visiting with her here, her present state of mind is always an interest to you. Is that correct?
Yes.
And in addition to all of the police reports, grand jury minutes, photographs, and things that you've described for us, sir, have you also had occasion to review all of the medical records without going through every one of them, dealing with Jennifer Tufts, Gelada, drugs that were prescribed to her, etc.?
Yes.
Were you able to take a family history and a school history from Lindsay?
Yes.
Were you able to take a medical history from Lindsay?
Yes.
Were you concerned about her status as a woman who had recently had a child, Callan, in the spring of 2022?
Yes.
And what time frame was it that you were focusing on for purposes of your evaluation as to her mental state after having Callan, when she was postpartum?
The time frame started in roughly September 2022 through January 2023.
And during that period of time, you were aware that she had certain symptomology. Again, we could go through every single one of them, or we can just say, yes, she did express that she had symptomology. Jury's heard the evidence up to this point.
Yes, many times
And
to other people.
Did she see doctors?
Yes.
Dr. Tufts?
Yes.
Was that the first time that she was expressing anxiety and her concerns about insomnia, and that she went to see Dr. Tufts and she was prescribed the SSRI?
Yes.
Okay. July, June, August of 2022. What was her mood at that point?
Her mood was waxing and waning at times, but struggling as well in common sense ways. Having 3 children, ages 5 and under, not an easy task.
So in the fall of 2022, when she went to see Dr. Tufts, that's when she was prescribed the first SSRI.
Zoloft, yes.
And that would, and again, when she had the second baby, that would be Dawson.
Yes.
Did she have also indicia, symptomology of anxiety and the symptoms that she had described that she required that she had to be placed on some medication?
Yes, she did.
What was that medication?
I believe that was trazodone, if I'm not mistaken.
When she was in nursing school, prior to that, was she placed on medication?
Yes, she was.
And that was because of public speaking nerves? What was the medication?
There were multiple medications. I believe it was propranolol, and I believe it may have been trazodone and Wellbutrin, but I'm not totally positive of that.
Do you recall that she was prescribed an SSRI when she was in nursing school?
Yes.
What was that?
That was Zoloft.
When she saw Dr. Tufts and she took the Zoloft, it was 25 milligrams initially, is that correct?
Yes.
Was it increased?
It was increased to 50 milligrams sometime later. Yes.
And how did she react to that?
She didn't take the medication initially. She waited a few weeks until she started on the lower dose.
So my question was, how did she react to the increase in the Zoloft?
Poorly.
What does that mean?
It was not a therapeutic uplift for her. She didn't do well. She didn't feel better. By all reports from Ms. Clancy, she did not get better.
How about sleeping? Did she have any complaints about sleeping?
Yes.
What was that?
Her insomnia got worse with the passage of time.
As September turned into October, it turns into November, around the time of Thanksgiving, had she continued to seek help from medical health care providers?
Yes.
The answer is yes.
Yes.
Who did she seek to get help from?
Well, the initial person, I believe, was her mother-in-law, Sue Clancy, and who was a labor and delivery nurse who knew people.
Who did she see as a result of Sue Clancy?
I believe it was Julie Paul initially.
And what group was she affiliated with?
South Shore Perinatal Health.
Did Ms. Paul, nurse practitioner Paul, prescribe medication for her?
Yes.
And did she continue to deal with South Shore Perinatal?
Yes.
at some point did she stop dealing shortly, a short period of time, with nurse practitioner Paul?
Yes, Nurse Paul left.
And why was that?
She got a transferred position. It had nothing to do with her patient load or
So she was transferred.
she was transferred.
Okay.
Yes.
So as a short period of time, she was transferred. Who was the next person that she dealt with?
Rebecca Gelada.
Did Rebecca Gelada have a particular position? Was she a nurse practitioner?
Yes.
And how long did she deal with Rebecca Gelada?
3 appointments.
And during that period of time with Rebecca Gelada, was she prescribed medication?
Yes.
What was the medication?
I believe it was Seroquel.
How did she react to that?
Poorly.
And as time went by, going into the holiday season, Thanksgiving, do you recall what her symptomology and complaints were to the healthcare providers at that point, whether it be Tufts or Gelada, anybody?
Yes.
What were they?
She had many concerns about her health. She wasn't feeling well. She felt out of touch with herself. She felt numb. She experienced disassociation.
All right, stop right there. What is disassociation?
Disassociation is a psychological construct that means you feel removed from your body. You don't feel in touch with your body. You feel different than the way you normally do. You look back at your life and you say, something is wrong with me. I'm not feeling the way I normally do.
Did she express, for example, when the jurors were looking at the medical records on November 27th of 2022 to nurse practitioner Gelada, that she felt that she was out of her body and that she had a disassociated state?
Yes, and that's sometimes known as a depersonalization. You feel removed from your body. You feel removed. You feel as if you are not in your full body.
Now, at that time, was she also complaining of other symptoms? And to cut to the chase, was she saying that she could not emote, she couldn't feel love, she couldn't feel happiness, she felt heavy,
Yeah.
she couldn't walk, she couldn't bathe, she had difficulty relating to people? Is that fair to say?
Absolutely. She couldn't get out of the bed. She had total flattened affect.
Did she then seek additional help?
Yes.
Where?
She went to the, I believe, the emergency room initially at South Shore to go to Mass General.
And did they prescribe additional medication for her?
I believe they did, yes.
Did she make any expressions to her treating physicians up to this point about what in her opinion, what the medications were doing to her?
Yes.
What did she say?
She said she was in a brain fog. The medications were making things worse. They were not helping. They were not helping her.
Now, as that time went on into the period of Thanksgiving up to around Christmas, did she continue to reach out to people for help, such as suicide hotlines?
Yes, she reached out to.
The answer is yes.
Yes.
Why did she call a suicide hotline?
She was worried about killing herself.
And did she get any help from the suicide hotline?
She was turned away.
How about the second time she called the suicide hotline?
She was turned away.
How about when she went to the Women and Infants program in Rhode Island?
They told her she was not a good fit for the program.
Why?
Because she was overly medicated.
And did she continue to seek help from healthcare providers?
Yes.
And what was the next thing that happened as far as dealing with healthcare providers for Lindsay in her postpartum stage?
She went to the Mass General emergency room.
What happened there?
On 12:30, she said she needed to go to the hospital. She was at the emergency room. She was sent to McLean Hospital in Belmont. It's a Harvard-affiliated hospital.
Now that McLean Hospital, when you say was sent to, fair to say that even though they had to transport her, it was a voluntary commitment?
Yes.
And what was her state of mind that caused her to have a voluntary commitment to the locked wards of McLean Hospital?
She was worried about killing herself, and she uttered concerns about killing her children.
How about, did she relate any intrusive thoughts and dark thoughts, things of that nature during this period of time, October, November, December?
Yes.
Tell me about that.
She said she had, quote, horrible thoughts, unquote. She felt that people could actually hear her thoughts. The thoughts were so loud that strangers could hear them. Sometimes.
She expressed at that point, for example, that she was concerned about school teachers with the Little Sprouts school with the kids, that they could read her thoughts and that she would lose custody.
Yes, it's called ideas of reference. You believe other people can hear what you're thinking, and that can have a very negative interpretation for the person believing that, feeling that, and thinking that the outcome is going to be a negative one, that their children may be relieved from their care.
Now, as it relates to the concept of a psychosis, can you tell me in 25 words or less what a psychosis is?
A psychosis is what's considered a major mental health disorder. It's when people have disorganized thinking, and the symptoms most typically are hallucinations. There are different types of hallucinations. 80% of people with psychoses hear voices. There are different types of voices that one can hear. Benign, get a glass of water. Benevolent, you're a good person, keep it up. Or malevolent, threatening them, telling them, ordering them to do something horrible, and you believe those voices.
Now, during that period of time, when she got out of the McLean Hospital, what medication was she titrating or getting off of?
I believe she's getting off the Seroquel.
Was she able to do that?
Yes.
Relating back to November 27th with the dissociative state, is that an indicia, is that an indication or a harbinger of psychosis?
Yes.
And is a psychosis, is that something that would be, somebody would be suffering from a psychosis for a month at a time, 2 months at a time, or is that short periods, or how does that work?
People with psychoses have intermittent symptoms. They can function fine one day, and the next day they can be hearing voices, they could be seeing things, feeling things, smelling things. To be clear, those additional types of hallucinations did not plague Ms. Clancy. She only had auditory hallucinations. But hallucinations are like the waves at the beach. They come and go.
They're called waxing and waning?
Yes.
And would you tell me, doctor, in your opinion, is an individual, and we refer to postpartum psychosis, is that a particular affliction that afflicts women that have had babies and they go through a period of postpartum depression and then ultimately postpartum psychosis?
Yes.
Can you tell us, is a person, even if they are in the throes of psychosis, are they able to make a phone call?
Yes, they can.
Are they able to drive a car?
Yes.
Are they able to say, hi, how are you? I'd like to have a hot dog?
Yes.
They don't have to look at the unicorn in the corner, right?
That's correct.